My name is Martha Santoni. I work with workforce pipeline development. So what that means is for Nemours Children's Health, we are a pediatric healthcare system. So pediatric means we don't see any patients that are 18 and above. So we start actually when a child is in vitro, when the mom is still pregnant with the baby, until they turn 18. Typically, if a child may have a diagnosis, like some types of heart conditions, cystic fibrosis, certain complex diseases, we'll stay with them until we find an adult physician to take care of the child. But we are different than other healthcare systems because we only see children. When you think of healthcare, you think of what? A nurse or a physician, a doctor. But there's so many other careers, so many points of entry into a healthcare system. You can get a certification while you're still going to school. In OCPS, they have Orange Tech, and there's multiple certifications you can get. For instance, a CNA, medical assistant, that you can get a job in healthcare. And once you're an employee of a healthcare system, there's benefits, and one of the benefits includes tuition reimbursement, which means we'll pay the cost for you to go back to school. And you can, at that point, you can become a respiratory therapist, you can become a registered nurse. There's so many different pathways you can select, and so many different areas as well. And if you're not interested in clinical, that's fine, because we have a multiple of non-clinical jobs available as well. The different types of career paths and what I do is a multiple area. So let's start first, clinical first. So an entry position in a clinical level hospital is mostly medical assistants. Medical assistants are needed in our clinics. So we have specialty clinics that are disease specific, diagnosis specific, like if you have diabetes or you need orthopedics or arthritis, or you have surgery. We have medical assistants. They take the vitals, they help the patients into the room, they might help the physician with certain procedures. And then from there, that's only a starting point. Well, you can stay in medical assistant, but there's so much more that you can do. We have people that become physical therapists, occupational therapists, respiratory therapists, of course, the RNs, the nurse, but then there's like the bedside nurse where you're taking care of patients on our inpatient side. So those are patients that are going to be in the hospital for a day or more. We have nurses that are just in our specialty clinic that just take care of the patients for their daily visit, and then they're going to go back home. After that, we have non-clinical side, and that's somebody that can be an administrator. If you like numbers, that could be a finance person, somebody that does budgets, somebody that projects where we need to go in the future. Florida is a very large state. We're north of the Okeechobee. Okeechobee is that big lake you see on the Florida map. And they might say, oh, there's no pediatric healthcare in this county or in this location in the city. And so they look at maps, they look at stats, they look at where the population is growing. And I know a lot of young people like social media. We have social media specialists because it's important for us to get our message out there. So we have marketing, we have branding, we have people that design our logos, design the information that we go out. We have a free website called kidshealth.org. So we have people that built that site, that built the content that goes into that site. So basically anything you do for any business, you can do it in healthcare that's non-clinical. Clinical side, of course, we ask for certain certifications, certain training. But once you're in our organization, we can mentor you to get where you want to go. So the culture in Nemours Children's Health, I would say we do ask, we're taking care of people's children. So once you take care of somebody's child, you have to think that how to take care of this child if this was my own child. So of course we want people that are proud of their work, that provide high quality work. Nobody wants somebody that's going to greet their child with like a sad face or frown or be rude to them. So we want people that, if you're a frontline worker and you're clinical, that you like to work with children and families. So we have a very diverse group of people. We have people from everywhere. This is Florida, so we have people from every state, every country that work in our organization. We celebrate our diversity and inclusion. I would say the personality is somebody that likes to deal with people if you're going to be clinical, because you're going to see people all day long. You're going to deal with parents, you might deal with grandparents, you might deal with children. So we think, if you enjoy working with kids, that's really important. We don't just see sick children. A lot of people think maybe pediatrics is changing diapers or dealing with children that are very ill. There's a lot of different children we see. Our primary care practices, they see babies to 18, and sometimes it's just getting a flu shot or just doing your physical or something very routine. Not every day is going to look the same. So you're coming into work, you're going to have some good days, some challenges some days. So it's a person that can be flexible and likes to be around people, around children, and wants to do the best they can and to make children healthier.